Hello and welcome to this podcast. This is Susan also Coaches College Nursing, and the subject today is pediatric dosage calculation based on weight, and this is from chapter 25. So in this podcast, we'll briefly go over some of the key points, but your modules and your chapters will have gone over the material as well. So between all of these methods, as well as practicing in class, hopefully you'll understand these concepts. We already began to do some converting of body weight in between pounds and kilograms. So that's what the chapters and modules talked about this week, as well as calculating dosages based on body surface area and using the West nomogram. The other key point is to look at whether a dosage is safe, and we'll go over that a little bit in this podcast. I wanted to also reiterate that we are not going to be working on IV flow rates for pediatrics this week. We'll do that soon. And I don't want you to worry about calculating a pediatric dose from adult dosages. We're not doing that. I know that your module did that. And once again, this one says we're going to calculate safe dosage ranges with IVs, and we'll do that during our IV therapy week. It's important to remember that the error rate in children is higher than it is in adults. They're saying that from Cohen, your textbook, that is 3 times higher. I don't know if it's changed as of this year. It's important that, and I'll say it several times, at least 2 other times in this podcast, that you need to check your calculations with another nurse when you're doing pediatric calculations, because the error rate is high. Oral medications are available in multiple strengths. You're going to have to do some dilution of medication, so when we get to reconstituting medications, that becomes important. Medications look alike, names sound alike, and sometimes parents are not educated properly, so that's our job as nurses. And of course, we just make medication errors when we calculate. Then the other thing that we did in our very first week is I had you look at household spoons to look at them to see that there are errors in using those devices to actually measure medications, because different sizes will measure out to be different amounts, so the dosages are not consistent. One of the things that we really have to work on in this chapter and these modules is to make sure that we understand what a safe dosage range is for a pediatric patient, and you'll be calculating, which you should have already started, calculating the weight of a child to determine whether or not the ordered range is within the safe range, or what we call within the normal range. And there oftentimes is a confusion, sometimes with even faculty, when you say the dosage is not safe, or and they'll say their thinking, oftentimes mine included, was that if the dose is too high, then that makes it unsafe. But if it's too low, it's also unsafe because it's not going to be therapeutic. There are physiologic differences between children, adults, and infants. They aren't just littler people. So your module does cover that fairly well. And that there are 2 methods to calculate pediatric dosages, and that's by weight, which we've started, and also by body surface area. And that is also based on height and weight. And it's our responsibility as nurses to verify that the dose that we're giving is correct. Remember to always double check your pediatric medications with another nurse. There may be times when there is no one to check it with. In that case, you're going to have to figure out some way to make sure that you're not making a mistake. But that rarely happens where you're totally alone and you don't have someone else to check with, including maybe a house supervisor that could come and verify your dose if needed. So let's review some of the basic principles when administering pediatric medications and doing the calculations. Use the same methods that we've already started having you use and practice with last week, whether it's ratio and proportion, dimensional analysis, or using the formula method, or as I've said before, using my hybrid method that I use. Remember, the pediatric dosages are much smaller, and sometimes you're going to need to use micrograms. IM or intramuscular dosages rarely exceed 1 ml. So if you've done your calculation and it's coming out to larger quantity than that, you must have made a mistake. Although occasionally maybe it's slightly over that, but again, check your dosage again. For smaller infants, it may be that you cannot give anything more than 0.5, 0.5 of a milliliter. Sub-Q dosages never should exceed 0.5 mLs. For dosages that are less than 1 ml, in order to be more accurate, you'll need to use a TB syringe. And I'm going to try to remember to bring those TB syringes into the classroom this week. If I don't, somebody needs to remind me. Pediatric dosages are rarely rounded to the 10th. That's why you use a TB syringe, so that you can go to the 100th place. Make sure when you're doing your calculations that you label them. I know in one of the classes last week we talked about whether or not you need to label or not. This is why you need to label, so that you make sure that you understand what it is you're actually administering. And again, know your institution's policy on rounding if there's any question about that for you. This is just a little reminder on converting a child's weight. So if you have it in pounds, you need to convert it to the kilos, round that to the 10th. Then make sure you're using a reputable source for your medication dosage ranges. You're not going to find that in the doctor's order. So the doctor is going to order a certain amount of medication to be given to the child, and you're going to need to look that range up. And usually we recommend you use your medication drug book. Some of the electronic health records actually have where you can click on the medication and it might give you the information that you need there. But generally speaking, that's why we ask you to buy your medication book. As you work on different units, you will find that they have a library of books for you to use there too. If you're looking at the total daily dosage, the amount that needs to be delivered in 24-hour period, then you'll need to see, does that dose need to be divided? And then how many doses are to be delivered throughout that 24-hour period? Whatever that is, you're going to divide that. And we talked a little bit about that in the oral medication podcast. When you're looking at the dosage range, you're looking at the safe range. The highest amount of medication that can be given in a 24-hour period or a per dose, and the lowest amount that can be given for a particular child. So first you'll calculate the weight, and then it'll say that the child can get, perhaps, let's make something up, like 10 milligrams per kilo per day. And then it's to be divided into 2 or 3 equal doses, whatever the recommendation is. So then you know what your information is. You calculate that particular child's weight, then you calculate the high and the low ranges, then you compare that to the ordered dose, and now you know whether or not this medication that has been ordered for the child is actually what we consider safe, if it falls within the range. One more time, let me tell you, before administering any medication to a child, always ask yourself if the dosage is safe. When in doubt, contact a prescriber before administering. If you have double-checked yourself, you've checked with another nurse, and it still seems out of the range of within normal, check with the prescriber before administering the medication. And again, I'm going to remind you, pediatric medication should always be checked by 2 nurses. Now here's an example for us to work. The order is for Dilantin 30 milligrams PO every 8 hours. The child weighs 18 kilos. The recommended dosage is 5 milligrams per kilo per day in 2 or 3 equally divided doses. So that's what's recommended. It can be given that way. The first thing we can tell is that it was ordered for 3 times a day, so we know that's appropriate. Now we have to see, is the dosage appropriate? So when we do the calculations of 5 milligrams per kilo per day, we find, when we multiply that by the child's weight, we find that that's 90 milligrams per day that the child could have. When we divide that by 3 doses, we find that 30 milligrams per dose is safe. Therefore, this order is a safe order. The child can be given 30 milligrams at each dose. Now, if you remember, I put a question like this on your test last week, and no one got it right, but that could possibly be because you hadn't had the instruction yet. So, calculating dosages using body surface area, and I mentioned to you last week that you can use it in pediatric patients as well as in burn victims, but you can also use it for patients that are undergoing cancer therapy and renal patients, as well as infants and children. The West nomogram is best known as the body surface area chart, and you have one in your textbook. I also have one on Moodle for you, and I have a podcast that I have made for you using the West nomogram. So what you need to do when you use the chart is you compare to the chart. It has norms for children with their height and the weight, and then you can use a straight edge, and you can decide whether or not what the body surface area is. Or you can use a formula to find out the body surface area rather than using the chart. And you'll notice that by using the chart, this is a quick, fast way in order to find what the body surface area is, so that you can now plug this number, the body surface area number, you plug that into the formula just like you plugged in the kilos. So in our last example, we have 5 milligrams per kilo for a 24-hour period, and instead, using this formula, you would plug your body surface area calculation right instead of the weight. You would put that into that formula so that you can find out whether or not the dosage is correct. This is just a photo and a quick look at what the West nomogram looks like. You'll see that in the center in the box you have, if you know that the child's height and weight is normal, you can do wham bam, check that part of the chart, and you can find what the body surface area score is. We call it metered squared, but that's what you go. If you're not sure on whether or not this child's height and weight is within the normal range expected for that child of that age, then the other alternative is to use the 2 outer measures. The height, as you look at the chart, will be on your left-hand side, the weight on the right-hand side, and then you have to use the body surface area score that's next to the weight. And that's where you would find, that's the actual calculation that you would plug into your formula, as I was just mentioning. And here's another example where they're saying that this is a 10-pound child. You can just check right there on the chart, and that's your BSA. Or it's a 70-pound child with, and you can look right up above there, and you'll take what the BSA is and plug that into your formula. Here's a close-up example of a child that weighs 50 pounds and is 36 inches in height. And they're saying this is an abnormal height to weight. And you can see that they've drawn a straight edge from between the height and then the weight, and then right on the BSA line, which is not marked clearly on this, but you can see right where the red line intersects would make the BSA to be 0.8 meters squared. Just a reminder that in order to use the normal column for the West nomogram, you must know that the child is actually of normal height and weight, and you're not supposed to guess. So if you're not sure, I would use the 2 outer measures. And just to reiterate, as I mentioned earlier, calculating the BSA with a formula is used in critical care dosing and chemotherapy for children and adults. It is the safest way to use a formula and a calculator that has the ability to use the square root key. And based on the measurements obtained, you can calculate your dosages for your medications for your patients. There are two different formulas, one for using the metrics and one for using household, like height and weight. So you just need to know which you are using, but the good news is you can use either one, but you can't cross between. So you have to use height and weight in household measures. So measure regular measures like weight in pounds, or you use the complete metric measurements. Here's a podcast that I have made for you where I actually demonstrate calculating the BSA. You may have seen this already. Otherwise, you can click on the picture and it will take you out to the other podcast. Just pause this one, click on that, and go to the other one and take a look at how to actually calculate body surface area. Thank you very much for joining me on this podcast. I have made several podcasts for you this week. Please review those. We will practice calculations in class, and IB calculations will be covered soon, but not in this week. Thank you. This is Susan from Coaches College Nursing.